Hey, Dr. Mark here, our Restore to More minute for the week. And today the topic is traction. What is traction? This video is mainly for the clients in our clinic who are under corrective chiropractic care. Everybody should know what traction is. But we're going to talk about the 4 C's of traction. So, what are they? Care, creep, consistency, and core. We'll go through the 4 of those. All right. So first of all, what is traction? Most people, again, our clients would know that a normal spine in the neck is supposed to look like this. And an abnormal spine has many different shapes, but this is one example. The spine has lost its normal structure. This compresses the discs, causes degeneration, and ultimately affects the nerves that come out of that area. So the first C is care. And really, the bottom line is that there's many reasons people don't do things. Don't go to the gym, don't eat healthy food. But the bottom line is that it's not a priority. So if I was to be honest with myself, why do I not traction every day, which I need to be doing? It's because I have not made that a priority in my life. Do I have the time? Yes. Do I know it's important? Yes. I haven't made it a priority. And so for whoever's listening, if you're not tractioning every day, then the reason is why not? It's not a priority. And the biggest reason that it's not a priority is we don't understand the power of what traction will do to your health, not just how you're feeling, but ultimately to what your spine is going to look like in 5, 10, 20, 30, 40 years. When I work out at the gym and I question whether I want to do the next set or push a little harder or go to failure, what comes to my mind is my family. And when I think about keeping my body healthy, it's that I'll be there longer for my children, for my wife. I'll have better energy for my patients at the clinic. And so your why is going to be different, but that's very personal. So the first C is care. Why do you care about doing traction? That's the most important thing. Number 2, the reason that the spine loses its proper structure is stress. Computers, trauma, whatever it is. And what happens is that spine loses its healthy position. There's a ligament right in the front of your spine called the ALL. And what happens is that really thick rubber band ligament starts to compress and contract, pulls the spine out of shape. So the second C is creep. What we know, now there's different kinds of traction. You have your Dakota wedge with an elastic. You have, again, more of a Pettibon type traction. We have the popular den rolls, adult, child size. Whatever you're using, what's happening is that roll is going to go in and reshape the spine. The science of a ligament says that the first 10 minutes of you doing traction, that ligament is quickly going to snap right back to its original shape. So although it's good for you, there's no permanent change to that ligament. Between 10 to 20 minutes, that ligament now is going to creep. It's going to slowly and permanently elongate. So the creep in traction is we want to get you between the 10 to 20 minute mark. Ideally, we're doing this 20 minutes a day, 7 days a week. That's when we're going to see amazing changes with not just how you feel, but the structure of your spine. The third C is consistency. Just as you know, with exercising, going to the gym 3 times a week, week after week after week after week is going to be better than doing 7 times a week for 1 week, taking a week off. 5 times the next week, taking 2 weeks off. So it's better to do this 3 times a week, week after week after week after week, than to go daily and stop and daily and stop. So consistency is the third C. And the last C is going to be core. What do I mean? Is that we can be tractioning 20 minutes a day. We're stretching the ligament, the spine is healing, but then we go to our office and the core muscles in our spine, we're just letting them collapse. And so doing tractioning but not keeping healthy core muscle strength with posture is counterintuitive. So we have to have good ergonomics, sitting, standing, whatever we're doing, to hold that tractioning that might be happening at the clinic. So again, here we have a lady with a reversed neck, advanced decay in the lower spine. This is cutting off the power to her right arm. And again, we want to get that person feeling better. We want to get their spine moving better. Ultimately, we want to get that spine corrected. Tractioning is the key to doing that. Think about your 4 C's. Try to get your tractioning every day for 20 minutes. You'll see miraculous changes in your health. Have a great day.